Question 24, which of the following is the most likely mechanism underlying his symptoms? Okay, increased parasympathetic tone during sleep, micro, whatever, sudden nocturnal, histamine, broncho. Okay, so I'm thinking respiratory. So this is a respiratory question, most likely. 47-year-old man presents with a chronic dry cough that worsens at night. Okay, chronic dry cough worsens at night is interesting. We'll talk about that. He denies fever, shortness of breath, or sputum production. He occasionally experiences a bitter taste in his mouth, especially after heavy meals, and he does not smoke or take any meds. BMI is 32. Let's start with A, increased parasympathetic tone during sleep. Okay, so the idea behind this was maybe this could cause a bronchoconstriction. If you're ever wondering, do we bronchodilate or constrict with sympathetic versus parasympathetic tone, just ask yourself, what would you want to happen if you saw a bear in the middle of the woods and wanted to run away? You would want to bronchodilate so you can get more air in and out of your lungs and better run away. So parasympathetic tone would result in bronchoconstriction. I still don't see how that would cause a chronic cough though, or the bitter taste, especially after heavy meals. That doesn't really make sense to me. Microaspiration of gastric contents is a fancy way of saying while you're sleeping, some stomach acid and whatever else is in your stomach essentially regurgitates and makes its way onto your larynx. That could definitely cause a cough. Absolutely. So this is the GERD answer. If a patient has GERD, then when they sleep, probably seen this if you know anybody with GERD, when they lay down, they tend to have more reflux, and that can cause a cough, a nighttime cough. And, surprise, surprise, if it goes too far up, then you might have a bitter taste in your mouth from some of that reflux. So B is looking pretty tasty right now, but I always make sure we look at everything just to make sure there's not a better answer. Sudden nocturnal respiratory arrest. So in other words, this is the sleep apnea question. Sleep apnea is definitely common with higher BMIs. Here we're at 32. So on that note, sure, but that wouldn't explain the bitter taste or the cough, so that just doesn't make sense. Histamine-induced bronchoconstriction, so like an asthma. Again, asthma worse at night, maybe, but bitter taste after heavy meals doesn't make sense. Chronic inflammation of the bronchial tree sounds like a chronic bronchitis, which could definitely cause a chronic dry cough. If we didn't have the dry part, then maybe, but the chronic bronchitis usually is productive. And again, it wouldn't really explain the bitter taste, especially after heavy meals. That's really a giveaway sentence here. So that one doesn't make sense. Oh, and we have a non-smoker. So chronic bronchitis in someone who doesn't smoke, pretty unlikely. So the correct answer here is B. We've got GERD, just worse at night when you lay down. That's an important piece of physiology that hopefully makes sense now.